pause and let's invite Cupful of Delights up here. I don't know why the invite thing is not working. Anybody have tips? Or maybe Cupful of Delights, you can ask. Oh, it says you're unable to join. Can't hear me? Oh no. Let's see. Can't hear me. That bodes poorly.
Okay, I think we got it.
Can you hear me?
I can hear you, but I don't think I can see you.
Oh, weird. Okay, well, it sounds like they can hear us. I got a thumbs up.
Okay, can everyone see Dr. Yin?
Cool. Can anybody confirm that you can see me? Because I can see you.
Okay.
Hopefully it's working.
Okay. This is fun.
Yes. So if you want to do an intro for Cupful of Delights, and I'll do an intro for Pandia Health.
All right. Excellent. Well, thank you everyone for joining us this evening. Many hearts out to you. I see Craig SUS is out there. But thank you for joining us today. My name is Candice Darien. I am the founder and wellness coach of Cupful Delights. And this was really started out of my own journey, trying to stay off of medication. And I'm not encouraging anyone to not do that, but I am encouraging everyone to be an advocate for themselves. I have an autoimmune disease called Polycystic Ovary Syndrome. And after trying to have a baby, going through IVF, I learned that I was just tired of medication and I really wanted to take control of my health. And one way I did that was I started eating healthier, started working out, and then I also started incorporating some teas that really helped my journey. And so that birthed our first line called Cupful Delights. And it's really geared towards women in ovarian health, women who need help with sleeping, women who need help with energy. And it's a really beautiful set of teas. And I'm so delighted to be here with Dr. Yin. We've met each other briefly at the PCOS Challenge, and then we reunited at the Entreprenistas Founders Weekend. And really, we have a desire to help women. So I'm going to pass the mic to Dr. Yin, and she's going to share more about the wonderful mission and the women-owned drive of Pandia Health.
Thank you so much for that wonderful handoff. So the whole reason I started Pandia Health was to make women's lives better. I was giving a talk to a bunch of doctors. Why do women take their birth control? And one of the top reasons was didn't have it in their hand, didn't have time to run to the pharmacy every single month. And I realized, oh my gosh, we all go through #pill anxiety. You get to that last week of pills, and if you don't get your medicine, there will be a dire consequence. And so I was like, given our technology, let us poke the insurance and be like, can I fill it yet? Can I fill it yet? Please let me fill it. And then we'll set it and forget it. Let Pandia worry so you don't have to. And then we ran ads, free birth control delivery. And 60% of the women that responded to free birth control delivery did not have a prescription. And it's like, oh, don't you know you need a prescription? And I'm a physician. I can write medications. And so thus Pandia Health was born. If you need a prescription, it's $30 once a year to use our expert doctors. We're a 100% MD team, and unlimited follow-up questions for a year about birth control, but only birth control because you only paid $30. And then if you have a prescription already and insurance, you pay us nothing. Thanks to the Affordable Care Act, no copay, no deductible, AKA free for any FDA approved birth control that someone prescribes. And that was the beginning of Pandia Health. Then we added acne because I'm adolescent medicine and I can take care of acne in my sleep. And then I hit menopause, and all my friends are like, menopause. And I'm like, yes, I will find the best treatment for me and I will share it with all of you. And along
Awesome.
our path, we were able to pick up 2 of the nation's menopause experts. There's only 1,300 Menopause Society certified practitioners in the entire country. And we have 2 of them. And ours are both OB-GYNs, and ours both have 20 plus years treating women in menopause. So we are about expert care, about expert doctors.
That's wonderful. I love that. And I had an experience to, work with you firsthand on my own journey. And I would say that not only did you listen, but you kind of gathered and made a holistic approach to my wellness plan using birth control.
Aw, thank you. Yes,
You're
I
welcome.
think so important that people with polycystic ovarian syndrome know that if you go see, the joke is, if you see an endocrinologist, the answer will be metformin. If you see an OB-GYN,
Yeah.
the answer will be the birth control pill. And if you see somebody who is your primary care doctor who's supposed to coordinate all this, bring this all together, the research actually shows that if you hit it from both sides, it's better than if you hit it from one side or the other alone. So if it were me, my friend, my patient, I would use both metformin and a birth control pill. The metformin to treat the metabolic stuff if you can't treat it with diet and exercise. And then the birth control pill to deal with decreasing the risk of endometrial cancer and also decreasing any kind of high testosterone states.
Wow. So what would you say, Dr. Yen, is like your favorite thing about what you do?
I would say, what makes me really proud is that we're bringing better than some of the major academic institutions' level of care to wherever you have internet and a mailbox. Pandia Health is in 16 states, and we're in the big states, and we encourage birth control tourism. So the example I give is we're not in Connecticut or New Jersey, but we're in New York. And who in Connecticut or New Jersey doesn't get to New York once a year? And as long as you can get in one of our states and be like, I'm in the airport right now, filling out this questionnaire, then our doctor in that state can legally write you the prescription, and then we can ship it to all 50 states. So we're in California, Florida, Texas, Nevada, New York, Georgia, Pennsylvania, Michigan, Minnesota, Wyoming. Just, I can't name them all because there's 16, but you get the idea.
That's really cool. And that's what I love about Pandia Health and just the partnership with Cupful Delights is that it's really targeted for women and making things accessible, because if we can have accessibility, that's just half the battle, as you just explained, how this all started for you.
Yes, and we're really proud to be the only women founded, women led, the only doctor founded, doctor led, the only moms founded, moms led company in birth control, prescription, and delivery. And as a woman of color, I realized that what we were teaching in the medical schools and still teaching is great if you're a Caucasian female that wants to bleed every month. But if you're of Asian or Black descent, I talk to my fellow doctors. I'm like, oh yeah, that pill we're teaching all the med students to write does not work for our people. And I was like, oh yeah, I had to go through 3 different birth control pills until I found one that worked and didn't have side effects. And because I'm an academic doctor, because I'm here to make women's lives better, I was like, well, we're going to fix this. So I took all the birth control pills. There's 40 plus different birth control pills,
Really?
8 different progesterones. Yes. And this is the public service announcement. Know this, that there are 40 different birth control pills, 8 different progesterones. And if you don't like one progesterone, be like, I don't like this progesterone. And know that there's 2 different doses, so it could be a different dose, or there's 7 other progesterones that you could use. Tell your doctor, but mainly I rank them all from most likely make you bleed, least likely to make you bleed, most likely to give you zits, least likely to give you zits, most likely give you munchies, least likely give you munchies. Took the one that we were teaching all the med students to prescribe, fixed it for the side effect we were seeing in people of Asian and Black descent. And with that, we see 82% of people new to the birth control pill continuing at a year versus the standard 30 to 55%. And that's the difference between somebody who knows their birth control and who's only been prescribing birth control for the past 8 years, and your Joe Blow physician who's doing everything all the time, doesn't have time to focus and specialize, right?
So we had to take a step back, Dr. Yin, really looking at what is PCOS, because I mean, I would love to share to the world what it is, but I got a doctor on the line. So really water this down. How did this come to be, and why don't more people know about it?
Yes. I think that, well, I'll answer the first one, your
Yes.
last one first,
Okay.
which is, I'm all about hashtag stop sucking it up. If there's anything bad, evil happening in your life as a person who was born with a uterus, bad, evil periods, acne, irregular periods, menopause symptoms, stop sucking it up. Talk to a doctor, get the care that you deserve, the care that you need. I love what one doctor said, African-American physician. She said, you don't get a Medal of Honor for white knuckling it for 5 years to see how long you can go before you get treated for PCOS, for menopause. If you have PCOS, menopause, anything horrible in your reproductive system or anywhere, please see a provider and get that treated. And if they blow you off, get a different provider, a different doctor. And so PCOS, Polycystic Ovarian Syndrome, what it is usually every month in your ovary, a bunch of eggs come out at once, and whoever gets the most estrogen wins, and then it pops out. But in PCOS, the female hormone, the way I like to think of it, the female hormone gets turned into the male hormone, testosterone, and then the eggs don't pop out. And so these little cysts keep trying to come, but none of them pop. And so then if you look at it in ultrasound, it's called a string of pearls. You have your ovary, and it has a bunch of pearls around it. And so that is the string of pearls that you see in the polycystic, poly meaning a bunch, and cysts being these little cysts that are gathering in your ovary. And then the testosterone component is what's causing acne, causing hairiness, causing balding. And so the two requirements to diagnose polycystic ovarian syndrome is, one, anovulatory cycles, meaning that you aren't having periods regularly, or these cysts are not popping as they should to let out the egg. And so if you don't let out the egg, and then the egg tries to hook up and nothing happens, and then your progesterone level falls, and progesterone is created by the corpus luteum as well. And when it falls, that's when you have a bleed. But if you don't have the pop, then you don't have the progesterone, and then you don't have the fall, and then you don't have the bleed, and then the lining of your uterus grows, and that's your risk of endometrial cancer. So if you're not bleeding every month without hormones, you are at risk of endometrial cancer, because that lining is just building. And so that is the polycystic ovarian side of it. The other second criteria is hyperandrogenism, and that can be from the signs, which is zits, hair where you normally shouldn't have hair, upper lip, or up towards your belly button, or just extra hairy compared. But certainly it runs in family. So just because it runs in your family could be that PCOS runs in your family, not that hairiness runs in your family. Like if you are having a full-on beard, that is definitely PCOS. If not a testosterone tumor somewhere else, it could be other things as well. But it's about irregular periods, and you could also get a blood level of free or total testosterone, but also just these signs. You don't need the ultrasound. If you have an ultrasound with a bunch of cysts, then that obviously also diagnosed polycystic ovarian syndrome. But the main negative risk of PCOS is that unopposed estrogen on your uterus, and the lining growing. And if you just add progesterone, it can stabilize it. Or if you add progesterone and then take it away, it'll clean it out.
Wow. I think one thing I appreciate about you is your animation to explain science. And really sharing with us a way that we didn't hear it before. And making it, you made it fun, by the way. I don't know if you were supposed to make all that pain fun, but you made it fun to really receive it.
Thank you. Yes, I think that's the way I remember everything in med school. I had to draw it out so I could picture, the egg and like the liver or whatever body part that we're talking about. And I think the more ways you can learn something, both hearing, reading, and visualizing it, the better it sticks in your brain. And because I'm an adolescent medicine specialist, I speak at the level of a teenager. And I like to make impressions by being graphic. So we'll emblazon into your brain, mainly to prevent unplanned pregnancy, but also just to teach science.
I love it. I love it. When my first exposure to PCOS was actually being diagnosed by a fertility specialist, because I really didn't know what this was. And I constantly go to, I can't say constantly, but when I'm supposed to go see the gyno, I see the gyno. When I'm supposed to go see the primary, I see my primary. And no one's ever mentioned this in my teens, in my 20s, in my 30s. And here I am in my 40s. Now learning that I've had this, and it makes sense because I've struggled with irregular periods. Though I was getting it, I would get periods that really the cycle would be very, very long and the periods would be very heavy. I would have hair in places that I'm just constantly embarrassed about. But I think all women do it to some degree, but not every day, right?
Yeah.
Not every day. And so, and the list kind of continues with a series of depression or being overweight, having high testosterone, as I've learned, feeling that when I eat food, it just hits a little differently for me. My husband always says, you are the healthiest, unhealthiest person, because I eat so healthy, but then he's like, how do you have this disease? So I'm like, insulin resistance. And so that's really what grabbed me to take control. Like you said, take control of this. Don't just take it. I figured out that the best advocate is myself. And if I'm going to get help, I need to speak up. But why is it, Dr. Yen, that when we're finding that if you go to the primary doctor and you say, what's PCOS? They say, oh, you need to see a fertility specialist. And a fertility specialist says, oh, you need to go see the primary doctor. How come no one's taking ownership of this? I mean, I find that advocacy for myself, I've taken ownership, but what do you see in the medical world?
I think the problem is that a lot of physicians, there's just so much to know and learn, right?
Yeah.
As I just showed you with birth control pills, because I'm in this business, I came up with this algorithm, but it took someone to be only doing birth control. I wrote 3,000 birth control prescriptions in 2 years. And normally a doctor would write like 5 a week. You know what I mean?
Right.
But because all I did was birth control, I was like, we got to fix this. I'm seeing side effects. Let's make things better, right? With science. And there's always scientists doing that. But you can imagine you go to medical school, you go out, and nobody questions what you're doing. No one's checking up on you. And that's why I like having an academic physician, because as an academic physician, you have medical students, you have residents, you have fellows, and like Dr. Yen, the latest paper says that you should do blah, blah, blah. And you're like, ooh, and then you like switch your practice to the latest paper because the med student and the resident's telling you what you should do, Whereas if you're just out in private practice, there's nobody asking, questioning you or whatever. It's a serious hierarchy in medicine. But I would say it's because there's just too much to know, too much to learn, and we don't know who's responsible for it. So exactly as you said, a primary care doctor should not be sending you to the infertility specialist for PCOS. That's only if you're trying to get pregnant and you can't get pregnant. But the question is, should the internal medicine, family practice, and OB-GYN know PCOS? Yes. Yes, they should.
Yeah.
Do they feel comfortable with it? Maybe, maybe not. So they might send you to an endocrinologist. They might send you to the OB-GYN. The OB-GYN absolutely should be comfortable with PCOS. But again, like I said, if you go to the OB-GYN, they're going to say birth control pill.
Right.
If you go to the endocrinologist, they're going to say metformin, even though the PCOS Society says birth control pill. But if you ask me, I would do both. I would do metformin and the birth control pill, because that you brought up is the insulin resistance thing. Is that the insulin, I believe, is turning the female hormone to the male hormone, and the insulin is causing all of the metabolic badness. And the metformin has really no negative to it other than if you have kidney problems, or if you're an adult alcoholic, and not like just drink a couple drinks, but an alcoholic, which most
Alcoholic.
people
Yeah.
are not in the United States. So, if you're not an alcoholic and your kidneys are fine, metformin is actually what a lot of people that are trying to life hack, live to like 100, 120 are doing.
Uh-huh. I love
So
it. Yeah, I appreciate that, because that was kind of my pass off. And, hey, I'm trying to help myself. And then all of a sudden, go here, no, you go there, no, they'll talk to you about this. And I got tired of it. Though I'm not on metformin, it was kind of suggested to take metformin. It was kind of suggested to go on birth control, but no one actually said, hey, this is what you really, really need. And then that's when I said, you know what, I have nothing to lose here. Let me try a more holistic approach so that I can feel like myself again. And I found, Dr. Yen, that I incorporated the 3 C's, and this is what I coach my clients to as well. But it starts with clean eating, because I can see a negative effect in my own personal life when I'm not eating healthy, when it's not the cleanest food, if it's processed food, if it's too much dairy. I can see a big difference when it's actually clean. And the clean eating that I've decided to take on was really this vegetarian path. And with this vegetarian lifestyle, not only do I get consistent periods, but I feel like I can digest better. And when I incorporated not only clean eating, but also consistent exercising, that consistency in exercising, that strength training, helped me lose weight. And then when I also incorporated calming effects, like calming techniques, such as yoga, meditation, just, I would say just praying, those things actually help my stress levels. So those 3 C's of clean eating and consistent exercising and calming techniques, that really was a game changer for me. Though I'm not against a science at all. I believe in metformin and I believe in birth control, but I think that was the game changer for me. How do you feel about that? And what do you believe in those techniques?
I think your 3 C's are amazing, and I think they're beneficial for everybody's health. And I can see how they absolutely could help control PCOS. They've shown that you don't need any of these medications if you can, exactly as you stated, lead a healthier life where you're getting consistent exercise, and that the clean eating, vegetarianism. I also work in an obesity clinic, and with
Yeah.
obesity comes insulin resistance, comes PCOS.
Mhm.
And so, if you can lose 10% of your weight, they've shown that a lot of PCOS patients lose their PCOS.
Mm.
So, it's the same kind of thing. If you gain enough weight, you will get PCOS. If you gain enough weight, you'll get diabetes. But if you lose 10%, then oftentimes you can get rid of the badness of obesity, the badness of hypertension, the bad negative effects of PCOS. And you've, done it. It's really hard to go vegetarian, and I applaud everyone and anyone who's done it. But speaking to my fellow obesity experts, they're like, the honest answer is we should all be vegetarian. It's better for the
Really?
environment, it's better for our health. You just got to make sure you get enough protein.
Right.
And that some vegetarians, I would say, do it wrong and go heavily on the cheeses, and then
Yes.
you end up with just extra fats, is the way I look at cheese. Though certainly, again, as an ethnic minority who's concerned about my bones, it's really important we get calcium. For the Asians, we do it through a lot of spinach, a lot of little fish with their bones, so we're eating the calcium. But even then, Asian women are the highest risk of osteoporosis, and then
Right.
probably Black women, as well as other people that are lactose intolerant. So please make sure you're getting enough protein. Please make sure you're not getting enough calcium. But the muscle building is also critical for preventing osteoporosis going into menopause, which is going into life. So you're doing everything right. And saying you don't need metformin, you don't need the birth control pills if you have self-treated your PCOS with great lifestyle, and certainly stress. Stress adds
Thank
to
you.
cortisol, adds to obesity. And so a lot of us are stressed out of our minds and would much benefit from meditation, from religion, from just, some mindfulness or being calm for 5 to 15 minutes a day. And I know it sounds like nothing,
But
but it makes a
it makes
huge
a
difference.
difference. Yes. It does. I love it. I love it. And you really resonate with me. What you're saying is, um, tea was first introduced to me by the Asian community. I have a lot of Asian clients, and hot water is a thing, right? With lemon. And they say, Candice, you want something to drink? And I say yes, and they just automatically give me tea. And I'm like, I didn't ask for tea, but that's what I get, right? But I
Yeah.
love it because tea for me has not only been that game changer, but it's been that part of that calming technique. And when I wake up and I rise, I drink what we call Unleash the Queen with very simple ingredients, but it goes a long way, especially with PCOS, is that spearmint tea, ginger, turmeric, cinnamon. All can help with inflammation, insulin resistance, lowering the testosterone. And then my favorite, digestion, right? What goes in must come out, right? And so I love drinking Cupful Delights, Unleash the Queen. And then if I'm ever at a point of, I would say, kind of down in the dumps, I drink some green tea, which still has caffeine, but has that antioxidants that's needed to give that extra boost and that energy.
Yeah, no, tea has also been shown to burn fat.
Yes.
One of my dad's colleagues is trying to isolate whatever it is in tea that burns fat. Obviously, he's failed because I haven't heard anything. But in the meantime, let's all just drink green tea.
He did not fail. Just hasn't found it yet. He just hasn't found it yet.
That's right. He just hasn't done it yet.
Is there anything out there that you would share with, I would say, our viewers tonight? I see the product doula came out today. She is part of the Entreprenista League, and we appreciate her presence. But would anything you would share with just someone trying to figure out their health? And there's a lot of, I guess the question is, here's the question. There's a lot of people in denial about having PCOS, or they just say, oh, I'm just this, or it's no big deal. What would you encourage them to do to make that first step to knowing themselves?
I think it's really important to hear that if you are not on any hormones, then you need to be bleeding every single month. And if you are not bleeding for 2 to 3 months in a row, then that means you need to get checked out. It could be PCOS, it could be thyroid, it could be tumor in your head, it could be stress. We've all been stressed and pushed our periods out.
Yes.
But as I mentioned, if it is PCOS, you're at risk of endometrial cancer, and that's not okay.
That's not okay.
And it is absolutely preventable. So do not let that lining build when it needs to be exposed to some progesterone and pulled out and cleaned up. But if you're on the birth control pill, patch ring, IUD with hormone, implant shot, you don't have to bleed every month because the progesterone is being given to you in all of those methods. But if you're not on anything and you miss 2 to 3 months of periods in a row, please see a doctor and get that checked out for your health, for your fertility, and know that there are metabolic consequences also with PCOS, and that you may want to talk to somebody about healthier living, the 3 C's as you mentioned, as well as metformin if the 3 C's aren't good enough for you, or you don't have enough time or energy, or just life is hard.
Yeah, life is hard. And so I'm going to make the questions harder, because if you have PCOS and now you're approaching maybe premenopause, how does that look for you?
Wow. Well, if you have PCOS and you're approaching premenopause, I would say if you're having, monthly bleeds, then that's great. But the hard part is like when your periods go away, is that the PCOS acting up, or is that menopause? And that one I would say is beyond me. That one you're going to have to see a gynecologist. I am an adolescent medicine trained physician who's really good at birth control. And I am a person who can, once we know you have menopause, treat it. But when you put the two together, that's a really complicated case.
It is.
I would leave that to the experts. That's one level beyond me.
But I love the fact that Pandia Health has the experts, right? And you kind of taught me something. I didn't know there was only a few in the nation, and you have at least 2 on the team. Is that correct?
That is exactly correct.
That's really cool. That's really cool. Just learning from Pandia Health. I'm so glad we crossed paths because your energy and your passion for female health has really been a game changer for me. And I love learning from you. I love using Pandia Health as an education tool. I think this is something that a lot of women, not even women, but girls, should be taught at an early age so they can feel empowered to make the right choices for themselves, right? Again, because we're all our own and our best advocate.
Yes. I'm all about knowledge and choice and options. We're not here to push one decision or the other. That's up to you. And it's really the future is shared decision making. Our job is to present you the information, the risks and benefits, answer your questions, and then you decide what risks and what benefits you are looking for and what you're willing to take on. Though certainly we have science and evidence and would strongly suggest some things.
Yeah, that's great. That's great. I really appreciate that. And how would we follow you? Can we follow you and how can we learn more about Pandia Health? Where do we go?
Yes, please follow Pandia Health, Pandia Menopause.
Yeah.
And then I'm trying to build my Instagram/TikTok. I'm so close on TikTok, people. Please send people my way. Dr. Sophia Yen, it's just DR and then Sophia, SOPHIA Yen. I'll drop it in the comments on TikTok and Insta, but I'm building up the Insta because I know the menopause women are more on Insta, at least I've seen, than on TikTok, though there is a huge menopause TikTok group. And we're also on YouTube. We have like a video with 300,000 plus views on Dr. Yen's tip, first time on birth control, what I suggest, which is don't take your pill first thing in the morning on an empty stomach. That is not a good thing, right?
Right.
Yeah.
Right. Yeah, that does a lot for pretty much for me, all pills, like even supplements. Just so you have to have something in the stomach. And everyone can follow Candice Darien at Candice Darien on Instagram or at Cupful Delights. Again, I'm the founder and also wellness coach at Cupful Delights. This was specifically created to help women with polycystic ovary syndrome. We started off with 4 T's and we are launching many more to come. But it really is about being an advocate for yourself. And I honestly and appreciate you, Dr. Yen, for partnering with Cupful Delights this evening. And I look forward to doing this again in the future with you.
Absolutely. We should do this quarterly, if not at least once a year.
Okay. Fair enough. I'll take that up for a challenge.
I love it. It's so good to see you and to hear your success story of your 3 C's. Kudos. Kudos to your
Thank you so much. And remember, for those of you following us on Instagram, we are doing a giveaway. We have Lights Out, which helps with stress. And I think that's what I'm going to do next, Dr. Yen. On the East Coast, it's about 10 o'clock tonight. And so I'm gonna call it Lights Out, which is a nice rubus with a little bit of chamomile petals. And I'm going to de-stress and go to sleep.
Nice. Good night.
Good night. Bye.
Bye.